Hey, Podcast Aquanauts, it's your host, Casey, here again. Okay, before we start the podcast, I'm going to conduct a quick poll. Admittedly, it'll be very one-sided. I can't see any of your raised hands or hear your responses, but just play along anyway. All right, how many of you have a pet? If statistics are anything to go on, about 2/3 of you should be nodding your head or thrusting a hand in the air right now. According to the 2023-2024 National Pet Owners Survey by the American Pet Products Association, 66% of households own a pet. That is about 87 million families, a number which is a bit mind-blowing. Okay, what does that tell us? Obviously, that means a lot of us live with animals. They comfort and entertain us, and in return, we provide for them and ensure that they get to live their best lives. That's the deal. So when your fur baby or bird bud or scaly sidekick gets sick, who do you call? That's right. You ring up a vet. Veterinarians are beacons of comfort and knowledge when animals take a turn for the worse, or even if they just need a quick checkup. We rely on them to steer us down the right path as pet owners and to always act in our animal's best interest. The same is true here at the aquarium, where our veterinary team is tasked with the enormous job of seeing to the needs of thousands of animals representing hundreds of species. It's a challenging job for sure, one that's defined by a lot of detective work, rewarding highs, and occasionally sad moments when nature takes its inevitable course. In this episode, we'll be chatting with the aquarium's longtime veterinarian, Dr. Chris Keller, and a more recent arrival, veterinary assistant Shelby Ferguson. We'll be touching on a lot of topics, from why seahorses make such difficult patients, to how aquarium vets prepare themselves to care for an animal they've never worked with before, to the many unique needs that present themselves when animals become older. That's a lot of ground to cover, and there's no time to start like the present, so without further ado, on with the podcast. Today, I have wanted to do this basically since we started the podcast all those months ago, but I am excited to be bringing in two very important people here at the aquarium. Our veterinary team, which consists of veterinary assistant Shelby Ferguson. Thanks for joining us, Shelby.
Thanks for having me.
And just straight up and down veterinarian, Dr. Chris Keller.
Yeah, I want to have that put on my tombstone.
Straight up and down veterinarian?
Just veterinarian, yeah.
All
That'll
right.
work.
Today we are going to be talking about how one becomes a veterinarian at an aquarium, but maybe we should go even more basic than that. What does veterinary work entail? So what do you do at the aquarium, basically?
So our roles here are kind of similar to what you deal with as a veterinarian in a private practice, working with people's pets, dogs and cats, and other assorted animal species. But here, we do a lot more associated with overall sort of gauging how well the population's doing preventative medicine. In other words, making sure that their nutrition and their behaviors and all those things are important. One of the things I think that's really spectacular about this place was the relationship that you're able to develop with people that really know what they're talking about. And it's not to say that owners of their kitty cats and puppy dogs and things like that don't have that same level of knowledge, but here you know that you're walking into a room frequently talking about an animal's well-being, and they could very well be one of a small handful of people that know anything at all about them or are leading experts in the field. And so it makes the Tennessee Aquarium's relationship with me and my relationship with them specifically really, really valuable and really important and enjoyable.
And you have had plenty of time to develop that relationship, because I do want to talk about origins, how each of you came to work here. And your story begins kind of concurrent with the actual start of the aquarium, right? You've been here since day one, or very close to, correct?
Very close to day one, yeah. When I first came to the Chattanooga area, I went into a private practice working for someone else in Fort Oglethorpe and had a good experience, a good relationship there. As we moved through that, though, it became apparent that the aquarium was looking to hire what was at that time deemed a consulting veterinarian, somebody that could come in occasionally with perhaps some frequent hours and be able to help them with their medical issues. That was in 1991.
And we opened May of 1992, so
yeah, so that
before
gives you
the
a little
doors
bit of a
opened.
handle. So I started, I think it was the first week of October in 1991, and had a pretty intensive working interview with some people that whose names still sort of rattle around. You hear people talk about some of the old timers that have been here, and then slowly developed a role that was more and more engaged and more and more, like I said, I've seen a lot of people come and go, but the relationships that I've formed here, and especially have right now, are very special to me.
So was having a more active and involved role something that you were pushing for, or something that just kind of came with the demands of the job, sort of naturally necessitating you?
There's a little bit of both. I think that for the most part, I always wanted to be more involved, perhaps at first, than they thought they needed. For example, they wanted to like put me on sort of a consulting role where they just called me whenever something went wrong. And I was kind of like, you know what? Speaking towards that whole concept of how preventative discussions and having this sort of interactions before something goes bad is so valuable. So I just made it a point to where I had to be down here 3 times a week, and I wouldn't accept the position unless they allowed that. And so basically, still to this day, Monday, Wednesday, and Friday are my days that I attend here, and it's really important to me that I see everybody pretty much on a daily basis, that they tell me what's going on. Now Shelby's filled a really valuable role for me when there's so much more going on than there was 35 years ago. More buildings, more animals, more, I guess, time involved, that it's just really, really important that you do attend as much as you possibly can.
Yeah, so you can be more proactive than reactive.
Exactly.
All right. Well, Shelby, so your story here at the aquarium is shorter than Dr. Keller's in terms of time, but how did you start working here? It's been a few years now, right?
Yeah, it's been a little over 3 years now that I've been here. It was 3 years in September.
So where did you come from, and what's your background in terms of the education? Where'd you go to school? What did you study?
I went to the University of South Florida, the St. Petersburg campus, and I studied biology with a concentration in marine science. That's what my actual degree says. So essentially marine biology. So I have a bachelor's from there, and then I went and did an internship at Moat Marine Lab in Sarasota, Florida, doing animal rehab, specifically sea turtle rehab, and really fell in love with it. And then happened to get a job at the Turtle Hospital in the Florida Keys as a full-time sea turtle rehabber. Did that for about 2.5, almost 3 years. And I applied for this job thinking, oh, they're not going to take this girl that only knows sea turtles. It's an entire aquarium. They have everything. I don't know anything about fish or freshwater turtles or lemurs. But somehow I got in here, mostly from Dr. K.
So you, to this day, you continue to work with turtles, though. You are, I believe, are you in charge of care of Stewie, our green sea turtle? Are you solely in charge of his care?
Yeah, it's just me. I feed him, do all of his training and monitoring and feed logs, all that good stuff.
I'll have to make sure that I include in the show notes a video that you were indulgent enough to film with me I think it was earlier this year, of a first-person point of view of one of your training sessions with Stewie, which is still one of my favorite videos. Oftentimes when we do these videos, the staff members will ask, do you want me to be quiet when I have you walk around with a GoPro on your head for an hour and a half? And I'm like, no. No, the relationship you have with the animals and the way you talk to them is actually one of the things I think is the most endearing about any of our employees and how they work with the animals, because everybody here cares about the animals. And I think that speaking to the animals really kind of brings that out. So I never want you to be quiet. And I love that video because the way you talk to Stewie is one of my favorite things.
Okay, can we do a jaw hold? Ready? Good. Great job. Good job.
So when did you realize that you wanted to work with animals? Either one of you can take this, but I mean, is this one of those things that dates back to being 3 years old in your front yard with your favorite household pet, or what's the origin story for you?
For me, and again, I'm going to be 65 next summer, I can remember, literally, I think some of my very first spoken words were talking to my mom about getting a hamster or some kind of animal thing. And to be honest with you, and I've always said this, you can learn a lot about animals. You can be really invested in your pets. You can do all those things. But to truly be an animal person where every single animal that comes along is of interest to you and you've read about it and you've studied about it, whatever, is not that common. And I have seen people, even in this profession, where you're just like, man, I don't know if they're animal people. And I can say that to Shelby or to you, and you guys get it. But I think, and it's not a demeaning thing, it's just that, there are some of us that just really, really feel it.
More than just a paycheck.
Yeah, more. Oh, yeah, absolutely. Every single person that works in this building could make more money in the private sector doing other things. But you recognize early on in your life that your pay isn't just financial. It's so many other things. It's satisfaction, it's caring, it's that feeling you get when you succeed and everybody around you joins you and that sort of thing. So it is very, very different from just, I always feel badly about people, and I know it's a nice way to make me feel better about, what I've done in my life, but they go to work every day and all they're really doing is keeping score. How much money's in this category and how much money's in that category and this and that, whatever. And I don't have that at all. I don't even think about that, never really have. So it's a different thing to be a real animal person and work for a place like this.
And so you lifelong then for you.
Oh yeah, from every minute. I mean, there were other things that kind of were shiny and attractive when I was an undergraduate, but it was always going to be animals. I thought I could be an architect. I thought I could be a musician. You know how that goes, but yeah.
So where did you go to school?
I'm originally from Pennsylvania. Ended up going to the University of Notre Dame in South Bend for my undergraduate degree. I did master's work on wildlife biology at the University of Tennessee in Knoxville. And my dream all along was always to be a veterinarian from the time I was a little boy and we had horses and I was a guy that gave the shots and did all that sort of thing. But then the interesting part of that is you kind of get off the rails a little bit, and I got a little bit sidetracked, and my interest in native wildlife became a little bit more important to me for a while. So I did that when I was in Knoxville, kind of reacquainted myself. I took a wildlife diseases course at the veterinary school, which is right across from where the wildlife students worked, right across the street. And I remember walking through those halls thinking, I have to do this again. Wildlife biology was great, but what I couldn't really get my head around was how it was all about populations, and individuals were important only as they add up to be populations. And so managing white-tailed deer or black bears or squirrels or quail or whatever you want to talk about is one thing, but each individual animal has worth, and I didn't fulfill that part of what I needed. So decided to go back into and steer myself back into veterinary medicine.
And so Shelby, your interest in animals also lifelong, or did it start later in life?
I would say it's probably pretty lifelong also. I mean, I had gerbils and hamsters and all that as far back as I can remember, and dogs and cats. And I remember specifically like one time I was just walking out on our driveway and there was a little hummingbird that had ran into the window and was kind of laying there, and I picked it up and put it in a little box and like nursed it back to health.
Successfully.
Wow,
you did better than a lot of kids.
A long time ago.
Sure, there are a lot of wild animals that were recovered by well-intentioned little hands and probably met their end at said hands.
Oh, yeah, I'm sure. So it kind of started with that. And then 6th grade is when I decided, like, I want to be a marine biologist. I want to do specifically, like, aquatic marine animals kind of thing. And actually, I went to a wedding recently back home, and one of my old high school friends was like, I'm so proud of you. You did that. Like, you, ever since 6th grade, you said you were going to do it, and here you are. You work in an aquarium. Like, that's so cool. And it is really cool. And I enjoyed a lot, and it wasn't exactly my path. When I found sea turtle rehab, I really thought that was what I was going to do forever. But I'm really glad that I made the decision to switch and come here and do everything pretty much.
I think it's a rare thing in life to have the kind of focus, and to be lucky enough to have to focus in on something that you can find fulfilling, and then kind of follow that path without deviating too much from it. I kind of did a similar thing. I knew from my early years of high school that I wanted to be a journalist, and followed that. This job is not entirely dissimilar from that, but I did do newspaper journalism for quite a long time. So good for all of us that we managed to find a path and stay on it.
Okay, so just going to throw the old man card out there. When you've been doing something that you knew that you were suited to do, that was going to be your job, and you do it for 35 years, you really feel like it wasn't a waste. You know what I mean?
Yeah.
And that's exactly where I am at this point in my life.
Yeah. Well, so you to talk a little bit about your work in veterinary, the veterinary spheres as they exist as zoological and then also private practice. You maintain a private practice, right?
I do. Yeah. Yeah.
So I'm assuming you'll have a lot to say here, but you have worked both sides of the fence. How different are those two worlds, working as a private veterinarian, working with people's household pets versus working here where you're working with hundreds of different species?
Right. Well, they both support each other in a weird sort of a way. An example would be that obviously my ability to deal with and diagnose and treat exotic animals in my private practice is much, much stronger because of all the experiences that I've had here over the years. The flip side of that is one of the things that I've been able to maintain here that maybe some of my colleagues might not, and again, I'm making a judgment which perhaps isn't always true, but I mean, I still really value, that's one of the nicest things about private practice is not just the animals themselves, but the relationships that the owners have with them. I can use that same sort of knowledge and care and provide comfort to people who do invest their entire lives in caring for animals here. And it's really, really been helpful for me to have both sides to look at. It's the warmth and the individual interactions with the animals that you have in a private practice setting. And then, the diversity and the knowledge and all the other things here. So it's the best of both worlds. It honestly is.
I think people probably have some inkling, and our conversation up to this point has already touched on it, about how you learn to care for dogs and cats and hoof stock, the things that people tend to think of when they think of a veterinarian. How do the two of you learn to care for so many different kinds of species from so many different taxonomic groups? Because I'm assuming that the kinds of things that afflict a crab are different than the things that afflict a lemur versus a penguin. So I don't see how any one person's brain could contain the knowledge necessary to know how to care adequately for all of those different kinds of animals. So how do you do that? How do you tackle the care requirements for such a diversity of species here?
Shelby, you want to talk about that first, and then I can talk for another 3 hours about it after that.
Well, I don't know about that. I mean,
it is again really interesting in that when I went to veterinary school and I graduated in 1989. And the whole process of learning to be a veterinarian involves learning systems and how organs work and anatomy and all these different things. And then at that time, there were relatively few programs that really had much to do with exotic animals. And I kind of laugh at that term exotic animals, because the animals that nature made or God made or whatever you want to say that live out there in the world, they're not exotic. They were here before we were. And the exotic animals are the Papillons and the Siamese cats and the different breeds that people have kind of created, like Frankenstein's monster in some respects. But point is that when you're dealing with exotic animals specifically, you come out and you just have to have an open mind and be able to sort of gather information as best you can from people around you that you trust and that know more about it than you do. And then you have to use your intuition and try and determine, okay, if I was this animal, what would I need and what can I do? And you have to use a lot of the principles that you learned in veterinary school, but you go way, way beyond that, because then you have to understand the natural history of each individual animal, where they live, what they do there. And I teach some classes periodically at the University of Tennessee Veterinary School, and I'm considered, I guess, adjunct faculty. But the conversation is always, when I talk to veterinary students, is like, before you can be good at anything with exotic animals, you have to know the animal you're working with, where it comes from, what it eats, what the environment is like there, and all those different things. And so many times, owners don't have that knowledge. And here we do, so that's a huge benefit. The flip side of that is that a lot of times, veterinarians will look at an animal and literally, some of them won't know what they have until they run over and they Google it, right? So, it's one of those things where just being a student of what goes on around you and how these animals perform and live in the wild is so important to how well you do.
Well, and you mentioned earlier, Shelby, that you kind of didn't see how you would fit in here since you didn't have a lot of information or experience working with fish and otters and that sort of thing. So, I mean, what have the last 3 years been like for you? Has it just been just a blitzkrieg of having to learn lots of different things kind of on the fly, or how have you approached it, and has it been a comfortable thing for you to have to sort of roll with the punches and learn about penguins one day and otters the next day?
Yeah, it was a big learning curve. Still is a big learning curve a lot of times.
Yeah, for both of us.
Yeah, for both of us. I think having the marine biology background was at least a little bit helpful because I had some like general, very basic knowledge about fish, specifically just marine stuff. And then I got the basics of blood draws and how to do x-rays and be a surgical tech and all that from my job at the turtle hospital. All of that stuff I learned on the job. And then bringing that here, I kind of tried to just take that basic knowledge that I have and apply it to every other species, but taking into account their differences. And talking to the keepers and the people that take care of them really helps me a lot because I get to know the animals, I get to know the species, I get to know individuals, because a lot of them have their own little individual quirks and behaviors that may be abnormal for, say, one otter versus the other. And I do a lot of research online, lots of papers, lots of books.
Google food.
Lots of Google, always. We have a little library down in the lab that I'm constantly going through. And then just like Doc said, talking to other people in the field that work in zoos and aquariums that know maybe some more about this stuff or have ideas that we hadn't thought of yet.
So when a new animal is we know an animal is coming, whether that animal has been relocated from another facility because they had a surplus and we were able to provide a home for it, or if we have, say, a new gallery opening and we kind of have a species list of animals we know we're going to be coming in and having to care for. How do the two of you prepare for the arrival of new species with which maybe we have not had any kind of past experience? Do you go ahead and lay the groundwork for future care by researching beforehand, or do you wait? Is it more like you do the research when an issue has come up and that animal needs help more in the moment?
For me, I think the first thing you do is you engage in conversations with the keeper that's bringing the animal in. And then as far as nutrition and all those other things, obviously it's a team effort. And again, that's one of the enjoyable things about being here is that it's always a team effort. And so when animals are destined to be brought in, I'm sure that Shelby and I both kind of, if we don't know anything about them, we're going to try and figure it out as early as we can. And waiting until there's a problem is kind of too late, like you mentioned. You know, you're going to try to make sure that you proactively avoid problems. And I always like to joke that my favorite animal in the Tennessee Aquarium is that big Galapagos tortoise that is made out of bronze because it never gets sick. You never have to worry about it. It's periodically going to be polished by some little child's backside when they're getting their pictures taken. And that's kind of the easiest ones. But there are some that are really easy keepers and some of them that are really intense. So you have to learn those things.
So the reference Dr. Keller is making is to, if you've never been to the aquarium, in our Island Life gallery, so the last gallery you explore before leaving the Ocean Journey building, there is a large bronze statue of a Galapagos tortoise. And yes, children do get up on it by design and get their photos taken. So that is what he is making reference to.
Yes, and the nutrition's really easy on him too.
Yeah, doesn't eat much. I don't think I've ever seen him.
He's really got it down. But anyway, that's one of the things that I think is important, is that you always have to be just willing. And if you're not willing to have people tell you things and explain to you things, then you can't be a veterinarian at a place like this. You can't do it. You can't be. There's sort of a little bit of a doctor mentality, and anybody that's had that surgeon that comes in that has terrible bedside manner and sits at the bed and pretty much yells at you or tells you what's going on knows what I'm talking about. You can't have that mentality, or if you do, you're not going to be as effective. You have to be able to respect and appreciate all the knowledge and everything from people that don't have their doctorate, but frankly, they do in a way because they've spent so much time doing their work. And everybody I know that has animals that they care for here has animals at home and has different kinds of things and different collections. And it's kind of fun because they are, again, referring to animal people. That's what they are.
Let's talk about actually the collaborative approach that we have here to animal care and well-being, because as you mentioned, the needs of the animals fall on a lot of different shoulders. The two of you, obviously, but you also, I think it's fair to say, rely pretty heavily on the oversight of the people who care for them every day. So talk about the collaborative relationship that exists between the two of you and the people who care for the animals day in and day out.
Yeah. A big part of my job is actually doing that, is communicating on a very regular daily basis with the keepers and the people that take care of the animals. And they're the ones that know every little behavior. They know the individuals. They know their husbandry, like their diets, everything like that is really all on them most of the time. And if there's something weird going on, they're going to know it and they're going to come talk to us about it immediately.
Like
even
Nipper the penguin isn't eating as much as he normally does.
Yeah,
or
no,
he's
absolutely.
favoring one foot over the other.
Absolutely. It's even something as simple as, hey, Louis the otter is a little bit more sleepy today. It's even something as simple as that they're like, something's a little off with this guy. We don't know what it is, but we want to have it on your radar. We want to talk about it and make sure that we're all on the same page together.
It's really heavily nuanced. In other words, these are a lot of times the things that we do and the way that we start is that it's very subtle signs early on. And I don't know how many times in my career I've said, well, let's just watch them. And honestly, wild animals, there's two things that you have to appreciate is that when you're dealing with animals that basically are not domestic, getting them out and sticking needles in them and catching them up and doing all that stuff is obviously a very stressful event. And in nature, there's lots of different homeostatic mechanisms where animals can make themselves well without veterinarians ever getting involved or veterinary teams ever getting involved. So just being on the front end of something, lots of times we'll just be watching and seeing, and then if it starts turning the wrong direction, then you get involved and you get more aggressive with handling and diagnostics and things like that. So it is always really super important, as Shelby said, and it's a very, very valuable part of what she does. And what I've done for a long time is to be able to talk. I'm familiar with other institutions and been to other places and gone on transports where we've picked up animals. And again, the relationship that I feel like we have with the people here is better than most. And I feel like there are some facilities where people don't want to go talk to the veterinarian. They don't want to talk to the veterinary technician. It's like it's them against us. And I don't feel that we've ever had that here. And that's one of the nicest things about, again, working at the Tennessee Aquarium is that we have been allowed to foster that. We don't have a lot of formal things in the way of communicating with staff, and that's not always the case.
Yeah, I'd say that of the places I've worked, this is a very unsiloed kind of institution. Even within our department, so between the communications department and the husbandry people, there are open lines of communication. It's something that we've worked very hard to maintain. So I can drop down by the veterinary office and be like, Shelby, would you like to be on a podcast?
Yes, and you've done that multiple times.
I have.
He's been chasing us for a while, people, just so you know. We haven't had that much time to give to Casey.
And that's okay. Yeah, I know you're busy. I always assume that if someone says no, it's not because they don't want to. It's because they can't because of other obligations. So I always assume that's the case. So Dr. Keller, you've been here at this point, you said, for 33 years. In that time, what has changed about our approach to your particular role I'm sure a lot has, but how has your job changed in the course of the last 33 years?
Well, again, it started out like I basically came in those 3 days a week, and then every 2 weeks I would send them a bill like I would if I was a veterinarian on a dairy farm, and I had visited their farm, and I was whatever this many hours, and I used these different medicines and what have you, and here, this is what you owe me. And then after a couple years of actually it being very cumbersome because I was here at different hours, I wasn't always adhering to a schedule. It was even hard for me to keep track of it. I just went to the powers that be and I said, hey, can you guys just give me a number per year and I'll just be your guy. And I won't be, nitpicky or beholding to, or certainly I think they've learned that I'm not like going to be upset if I work a little bit harder one week than I do another and that sort of thing. And that's been kind of one of the ways that I've kind of had like 2 full-time jobs my entire career between the practice and here. And the nicest thing, I guess, is that as I've gotten older and older, and seems like older and older, as I've been here as long as I have, I think there's been a lot more other types of things that have been sort of like kind of cracked the door to, talking about personnel issues, talking about other things that I guess theoretically are more supervision or more administration stuff. And I enjoy that to a degree. I do think that sometimes, I always have to make it clear that the animals are always going to come first. If I've got to meet about something else or whatever, we'll get there when we get there. But it has evolved into a much more expansive thing, and we're doing way, way more. I mean, when I first started, we had 1 building. I really wasn't even allowed to get involved with the fish, which was kind of odd. And then I remember the first...
When you say you weren't allowed to get involved, what do you mean?
There were no programs, or there were virtually no programs where veterinary medicine involved fisheries and fish science. And there were 2 or 3 vets that kind of started working at veterinarians, at aquariums, and they were kind of... To be honest with you, they were a little bit hard to work with and kind of crotchety. And some of the people that started this worked with several of these folks, and it was just like they had a hard time with allowing a veterinarian in. And honestly, what I knew about fish wasn't that much, but what I knew about how animals work and physiology and how medications work, I did know a lot about. And one of the nicest things is like very early on, I remember one of the past employees here came to me and said, some of the bonnet-head sharks weren't eating really well, and can we give them a B12 injection? And B12 injections can sometimes stimulate appetite. I understand where they were coming from. You just give them a shot, whatever. And I said, are they stressed? What's going on? And he said, well, yeah, I guess they are. When we started them on some steroids, and the animals immediately started to eat and started to feel better, and all these things happen. And believe it or not, that sort of cracked the door, so that a lot of the fish people then began to feel more confident in talking to me. Number one, that I wasn't going to belittle them, and I wasn't going to be, at all critical of their perspective, because I needed to learn from them as much as they needed my help. So it slowly evolved into something where there was every animal here. I write health certificates for jellyfish. It's like it's kooky what I'm expected to do sometimes, but the flip side of that is I wouldn't have it any other way. I mean, if it's under these roofs, then I want to be involved. So you and I think, have talked about this in the past, and I kind of can't remember the trajectory that this conversation took, but when you look at the field of veterinary medicine, are there more people or fewer people seeking jobs like the 2 of yours, based on just, even if it's just anecdotal? Are more people wanting to get into zoos and aquariums, or is there less interest in that than there used to be? It's vastly more people want to do this. And one of the things that Shelby sort of touched on when she was talking about, she felt like the odds of her getting to work here were slim when she interviewed and what have you. And I will tell her that the minute I met her, she had a 100% chance of getting the job, because I knew how much work she was going to put into it. I knew how hard she was going to strive to learn, and I knew where her heart was as far as the animals were concerned. And I think one of the things that happens in the field of veterinary medicine, it is lots and lots of students go in. And remember, to get into veterinary school is pretty challenging, and these guys have performed very well at academic settings in the past, and They have their hopes and their dreams, and that's what fuels them. But one of the things that there's, like, for example, the field of marine biology, there are thousands of people that graduate with degrees in marine biology, thousands of them, and they accomplish and they do well, but there might be 15 or 20 jobs a year nationwide in that actual field. And so one of the things you have to do is A, be persistent, B, have a lot of luck, and C, you have to constantly groom what you know and learn so that you're entitled to get these jobs.
Shelby, I do want to ask you a little bit about something about your involvement here at the aquarium that I've always really applauded or been impressed by, which is you seem, since you've been here, in just the 3 years you've been here, you've been kind of at the center of a couple of different stories of new techniques and new equipment that we were introducing. So thinking in terms of the cold laser therapy that we're using to help a lot of animals, I guess, but specifically you and I worked together talking about our red-ruffed lemur. And then the portable X-ray, it's a cassette, I guess, is the official name, right?
Mm-hmm.
It's like Bluetooth.
Portable X-ray imaging. What is the impetus for your interest in kind of looking at those new techniques, and how has it felt to see that your voice has been listened to and that your input is valued?
First, thank you, Dr. K, for all the very nice things that you just said. I really appreciate that, and I'm very glad that I'm here. I really pushed for a lot of this new technology because I'm a big believer in just there's always something new to learn. You can always have more information. You can never have too much information. And any equipment that gives you better, new, more information is going to be better for the animals. And really, that was the drive behind everything. I, in terms of cold laser, had used it in my previous job and saw the amazing healing properties of that thing.
Can we take just a second to explain exactly what cold laser is? Because it
Yes.
sounds like something that a Bond villain would use. So kind of
Space age.
Walk people through exactly what that is, because I learned about it actually as a course of covering this story, but some people who are listening probably don't know.
Yeah, so they call it a cold laser. It's really a class 4 laser. It is called cold laser because it's the only version of a laser like this that does not produce heat. But it's a really interesting, really cool tool that uses different wavelengths of light to basically activate your cells and promote healing and help with pain. And
Like they penetrate the skin. So
it goes through the skin, the muscle, bone. I mean, depending on, there's all kinds of settings that it has. So you have one for arthritis, for example. So that's going to go a lot deeper than something for a wound. That's going to be more superficial. So it has all these different settings that changes the wavelengths and changes the joules and all this fancy stuff on making it so that it's targeting what you're wanting.
So joules, like a measurement of power output.
Yeah.
Not like emeralds and diamonds.
Yes.
Yes.
Not,
Joules, like
turquoise.
Yeah.
Okay, so cold laser is one of those things that you brought in. The other I mentioned was the portable X-ray, which I just think they're really cool to watch you put these tools to use. But I also love what they represent in terms of like you said, the philosophy of being your personal philosophy, but also the fact that we as an institution value that thought process as well. That the more tools you have, the more information you have, the better off you're going to be in terms of that animal's care and well-being.
Yeah, absolutely. The X-ray, there was a lot of things that we couldn't really X-ray before having the portable, like a shark, for example.
Or a penguin.
Or a penguin.
Yeah.
It was something that we had never been able to really do before because penguins are a good example. They're hard. They have to stay cold, and taking them across the plaza in the middle of summer if you had to and then
to
down
your
to
office,
our
which
office,
is in the bottom of River
which
Journey.
is in the basement, is a lot of stress, and you can't keep their temperatures like that. So being able to take it to them made it so much less stressful for us and for the animals, and a lot easier for us to get the information that we needed.
So,
Sorry, go ahead.
That's okay. So to be clear, equine veterinarians, people who do a lot of field work, have had portable X-ray for a long, long time.
So horse doctors.
Right. Well, large animal veterinarians is the next one.
Anyway.
Yeah. One of the things that I think differentiates this particular unit is it's really, really incredibly detailed, wonderful images, and it's a big, just looks like a big piece of white plastic, and it's not connected to anything else, which is really pretty weird. Again, that's the Bluetooth technology that now is available. And what's fun about working with Shelby is like I'm old, right? So a lot of the things that have been done in the last 20 years in the field of veterinary medicine, I haven't necessarily passed me by, but they're not things that necessarily I would have been acquainted with or been able to use very effectively. And I think the most important thing is that when you're doing diagnostic tests on animals, especially animals that can be stressed by handling and everything else, your emphasis is always do no harm. Don't make trying to figure out what the disease is worse than the disease itself. And do all these different things that are not invasive. And that's where the cold laser works as a therapy. That's where the radiographs work as that. Ultrasound works, endoscopy, all these different things that put us in a position to be able to understand what's going on with that animal so much better, but yet we're not endangering them.
Yeah, when you talked about the hands-off approach, the minimalization of stress to an animal as a foundational principle when it comes to how we care for animals here, I immediately thought of the X-ray, because it is one of those things that if you do need to have access to that tool, it's a good way to get that information without causing, like you said, harm.
It is, and quite honestly, an animal who is not domesticated, just any of the smallest little things can really, really set them off and cause them problems. And there's constantly being these studies in the AZA and the different zoo fields where they're measuring cortisols and trying to determine what stresses different things do. And not that all stress is bad, and even negative stress is not always bad. But, it, in some ways it enriches our lives. But basically, we don't want to be the cause of an animal not doing well. So for us to be able to minimize our side of it is really incumbent upon us.
So when something does happen with an animal with which maybe you are not familiar, and you consult the books in the library down in the office, and you look at Google, and there is just there just isn't anywhere to work from. There's no information about an animal from which to base a treatment plan. What do you do? I'm assuming that part of it has to be reaching out to other institutions, because you mentioned there are only 10 or 15 maybe jobs for marine biologists in the country a year. I imagine the number of roles at zoological institutions is equally small, and it's not even every year. It's maybe once every 10 years when somebody decides to leave. So how closely do you communicate with your peers at other institutions, and how important is that communication to dealing with situations that arise, especially with an animal that maybe there is less formalized literature to document past treatment?
So one of the most important things that I can do is know who to call when I don't know it. And very often there are situations where we don't have the experiences. We don't have the interactions. We've never treated a specific condition or a specific species. But just getting on the phone with somebody who might have, or has heard anecdotes, or has written papers, or has some involvement either with that species or with that type of disease process or whatever, is really, really important. We frequently reach out to, and they're not always veterinarians, we reach out to parasitologists, we reach out to people that work in the dog-cat field on orthopedic questions. We do all kinds of different, you just have to be able to source a lot of things. And the most important thing is you can't be too big for your britches to make those phone calls. And so that's kind of a nice thing as you develop that network. And again, a lot of the people I'm talking about might be really new to the field, and then there are some that have been there, done that. They're the same age as I am and have been around for a while. So it makes it kind of, and often Shelby and I will call somebody and say, geez, I don't know. I have no idea. And then you got somebody at least that you can bounce it off of.
Groupthink.
Yeah. What you're thinking about doing. And then they'll say, well, let me know how it goes because this is going to happen to me one day and I'll need to know. So anyway.
I think back to to give a specific example, it makes me think of what happened with trying to treat one of our red-collared brown lemurs. I think it was late last year into the start of this year.
Right.
And just not knowing what the issue was. And I remember you reaching out to the Duke Lemur Center. Is that right?
Yeah.
It seemed at the time that was an important tool to have in your toolkit as a veterinarian, specifically at a zoo or an aquarium, is just, like you said, the willingness and openness to reach out to your peers to kind of think through a problem together.
Well, one of the best things is not so much that they necessarily know or that they can tell you exactly what to do, but they can say, yeah, what you're thinking about doing makes sense, and I would do the same thing. And it gives you that little bit of confidence that you need to pursue it in the angle, in the direction that you're trying to do it. So that's one. And again, these are all very gracious people to give us their time and help us. And when I think about the amount of knowledge that somebody at the Duke Lemur Center has about lemurs compared to what I could ever have, or Shelby or anybody else, it's just vast. So it's kind of fun, to be able to have that. And one of the other nice things about it is that there's always respect. They have respect for me, and of course I have tons of respect for them, and it makes it a much more easy conversation because of that.
So I want to start us down the path towards ending this episode of the Podcast Aquatic, but I did have a few, I'll not call them lightning round questions because we don't have to answer them that quickly, but I did ask the listeners of the Podcast Aquatic to send in some questions for you. There wasn't a whole lot of time, so I didn't get many questions, but I did want to ask one that came from my mom, who we'll just call the Mothership Aquatic. She wanted to know, what species would people be surprised to hear is difficult to work with, or that maybe has more complicated care requirements than you might assume?
Seahorses.
Really?
100%.
Mm-hmm.
They are difficult. And at one point, you guys might remember that we had a whole exhibit gallery that was seahorses or
Beyond Imagination, I think was the name.
Or seahorse-like animals like the sea dragons and the pipefish and those sorts of things. And they are prone to multiple different disease processes that I think is also present in fairly extensive amounts in the wild. So here you're thinking about or trying to deal with certain diseases where you don't have that huge advantage of all that water diluting all those bacteria or all those toxins or all those protozoal parasites, but yet, you're able to close it down and sterilize it if things go really awry and that sort of stuff. So yeah, seahorses were always remarkably. In fact, we used to joke that when somebody comes into the aquarium as a new aquarist,
I've heard this.
Put them in charge of seahorses because they will learn the ups and downs quickly. And they will know that sometimes you don't always win, sometimes you lose, but most importantly, they'll learn how to think through all these different processes and learn the most minute, finest aspects of caring for aquatic creatures in the seahorse gallery.
You didn't even have to think about that.
No, and I would agree because I think my entire first year was basically dealing with seahorses and just flushing their pouches with antibiotics and putting catheters in their pouches to release gas bubbles.
And doing feeding tubes and treating all these different things. And,
all kinds of
and
baths.
that's when we only had the one exhibit.
Yes.
Imagine if you had 10 of them or 12 of them like we did. So
that's true. So if you're looking for seahorses, we still do have some in our Boneless Beauties gallery. So they're still around. Even if you're a seahorse fan, that you can still come and see them. I think we have pot-bellied seahorses.
Yeah,
we do.
It's named after me, by the way.
We actually just put 19 more in there yesterday.
Went in yesterday.
Wow.
So.
Okay. All right. So if you come anytime soon, you will probably still see them. And then conversely, what is an animal that is maybe you would assume would be difficult to care for, but is a surprisingly maybe compliant patient?
Have any ideas, Shelby?
Easy, but wouldn't be. Species-wise, I can't say, but I can say specifically Lyra.
Yeah.
Our red ruffly
I was actually going to say that lemurs they're not, they're very much like, because of their level of intelligence and their anatomy and all these other things, it's really hard not only care for them but care about them, and they are remarkably tolerant of like a lot of the things that they do to each other and all the different sort of interactions that they have. As you know, lemurs go through every animal basically goes through a breeding season, and when it's breeding season, it's like having a fraternity of a whole bunch of boys, and there's one girl that's really cute walks into the fraternity, and they're all picking fights with each other. And the same thing sort of happens with lemurs, but yet they do amazingly well at sort of taking care of business and taking care of themselves. It's only rarely when we have to really intervene a lot with those guys.
Could say the same maybe about elasmobranchs in general.
Oh, yeah.
Sharks and rays.
Sharks
and rays especially.
Yeah. The way they heal.
Yeah.
Like a boo-boo on a shark, if you look away and look back, it's healed. It kind of reminds me of who's the character on those shows you guys watch? The guy with the things that come out of his head. Wolverine. You know how he would always dump the bullet out when he got shot.
When you did that.
Well, elasmobranchs are pretty remarkable at that sort of thing. If we could heal like sharks and rays do, we wouldn't need surgeons.
Yeah, there was a lot of, I think, alarm probably when people saw the signs of, or the wounds that were sort of left behind by the mating behavior of sand tiger sharks in our Secret Reef exhibit a couple years ago. And I think you explained it that they are sort of designed for that interaction.
They are. That's a completely normal behavior in the wild.
We should explain what that behavior is. So the reason they have the wounds that they had is because
the male literally grabs with his mouth the female. And of course, I don't know if you've ever been around a shark's mouth. There are a lot of sharp teeth in there. And inevitably they suffer wounds, and they look pretty heinous sometimes. And 3 weeks later, they're gone. And it's kind of like, how did they do that? And again, it's one of those valuable lessons we learn where some people are 1,000% believe that humans are the pinnacle of all the different animals and whatever. In some respects we are, and in some ways we're at the bottom because the capacity and the capabilities of all these different animals is so exceeds ours in so many different ways.
Yeah, if a sand tiger shark were to grab hold of you and tug you from side to side.
Well, you're in the hospital for 6 months, and they put your limbs back on if they can and all that stuff. So, yeah.
All right. So I do want to talk this almost could be its own podcast, and if it needs to be, we can certainly bring the two of you back in. But one aspect of your jobs that I think is really a challenge maybe about your job that is a direct result of how well you do your job is the fact that we are, as an institution, more and more having to accommodate the needs of geriatric animals, so animals that are older than their median life expectancy at an AZA, or Association of Zoos and Aquariums accredited facility, which is what we are. So if you can, in brief, and if you can't, then you can just say pass or rain check, and we'll talk about it then. But talk about how the appearance of those needs or the aging of our animals is affecting your specific roles here at the aquarium.
Well, I think one of the things that Shelby and I both, actually, she was one of the moving forces behind this, is that there are, again, that hands-off principle that we've always held. And, if you're taking care of them properly, they don't need a lot. You just have to try and simulate what they need to have in the wild in order to do well here. But we've begun to become have a little bit more initiative and kind of watch them. And when I say watching, it doesn't mean just looking at them, although that's really important. It means doing blood work more frequently, getting hands-on more frequently, kind of working them through these specific problems. And for example, when otters get older, just like us, their teeth can go bad. And so we're very, very vigilant about watching their teeth. And we just did a dental the other day on one of the otters. And so, you do have to proactively provide for them every single thing that they need. And again, you take risks when you handle an animal, certainly when you do general anesthesia. But the most important thing is that if you can advance better quality of life for a longer period of time, then it's a worthwhile thing to do. And that's kind of where we're coming from with some of these older guys. It is our privilege to be able to have animals that have lived well beyond what they normally do in captive settings. And usually exceeds how long they live in the wild by a significant amount. So anyway, that's part of the burden of maybe being successful, but it's worthwhile.
Anything to add to that, Shelby?
We also just kind of push for accommodations almost in exhibits as well. The exhibits were already there, and We added some ramps to our otter exhibit due to arthritis that our older otters were experiencing, and they were having trouble getting down the stairs as easily as they used to. So it's even simple stuff like that, just making the way that they get around their habitat easier for them.
And they like to belly slide on them, which is
They
fun to
do
watch.
like to belly slide on them, yes.
Diets, another part of animals as they age. We manipulate their diets and are a little bit more, again, trying to pick the slots that'll help them do well for a long period of time. As everybody knows, as we get older, we need fiber. And so many of the animals that are more elderly get more fiber in their diets for that specific reason. So
A lot of interesting parallels between caring for older animals and caring for older people.
absolutely.
All right. Well, I think with that, we can probably go ahead and wrap up this somewhat longer than usual episode of the Podcast Aquatic. But I think the conversation went longer because it needed to. Your role is a very important role. It's very multifaceted. So I think we did a pretty good job of covering a pretty broad swath of what your roles entail. So thank you to both of you, to Shelby Ferguson, our veterinary assistant 2 at the aquarium, and to Dr. Chris Keller, our longtime veterinarian here at the Tennessee Aquarium. Thank you, both of you.
Thank you.
Thanks,
Enjoyed it.
Casey.
Thanks again for joining us for this latest deep dive on the Podcast Aquatic. Digging into the work of our veterinary team was actually a suggestion from a listener, so believe it when I say I do actually read your comments and emails. If you've got a comment, a question for one of our experts, or an idea for a topic you'd like us to cover in a future episode, write it up, slap some digital postage on it, and send it along to podcast@tnaqua.org. And while you're doing all that digital stuff, be sure to leave us a rating or a review on your podcasting platform of choice. The algorithm is a hungry beast, and it helps us out tremendously to get that kind of feedback and engagement. Thanks again, and until next time, remember, every drop matters.